If you have sciatica or frequent headaches, dry needling may be the missing piece that helps your body finally relax, reset, and heal. A lot of people are surprised by how it actually feels and why it can make such a noticeable difference. So today I want to walk you through what it is, how it works, and who it may help most. If you have been dealing with pain that keeps coming back, stiffness that will not let up, or headaches that seem to show up out of nowhere, I want you to know you are not alone. At Waves of Wellness Chiropractic, we see so many people in Leland and the surrounding areas who are trying to push through discomfort that is affecting their work, sleep, driving, exercise, and daily life. Sometimes the pain is in the low back, buttock, leg, neck, or shoulders. Sometimes it shows up as a headache that starts at the base of the skull, behind the eyes, or across the temples. And sometimes people do not even realize that tight muscles and irritated trigger points may be a major part of what is keeping the problem going. Dry needling is one of the tools we may use to help address that. It is designed to target tight, sensitive areas in the muscles that can contribute to pain, tension, and reduced movement. When a muscle has been guarding for too long, it can stay locked up and send pain signals even after the original issue should have settled down. Dry needling helps us reach those specific areas so the muscle can release more effectively and the nervous system can start to calm down. That is one of the reasons it can be helpful for sciatica. Sciatica is often talked about like it is only a nerve problem, but in many cases, the surrounding muscles, hips, glutes, and lower back are adding extra irritation and tension. When those tissues are tight, they can worsen the symptoms, make movement feel limited, and create a cycle where the body keeps bracing instead of recovering. Dry needling may help reduce that muscular tension, improve mobility, and make it easier for other treatment strategies to work better. It can also be helpful for certain types of headaches, especially when tension in the neck, upper shoulders, jaw, or upper back is part of the picture. A lot of headaches are not just about the head itself. They are often tied to posture, stress, clenching, prolonged screen time, and muscle tightness that builds up over time. By addressing those tight points directly, dry needling may help reduce one of the physical triggers that keeps headaches coming back. Now, let me explain what it actually feels like, because that is one of the first questions people ask. Dry needling is different from what most people expect. The needle itself is very thin, and the goal is not to inject anything. It's to stimulate the trigger point. The sensation can vary depending on the muscle and how irritated it is. Some people feel a quick pinch, a twitching sensation, or a deep ache for a moment when the muscle responds. Others are surprised by how mild it feels. The important thing to know is that the sensation is usually brief, and many patients describe feeling looser or lighter afterward. Is it the same as acupuncture? That is another common question. While both use very thin needles, the purpose is different. Dry needling is focused on treating muscle tightness and trigger points from a musculoskeletal and movement-based perspective. The goal is to reduce pain, improve function, and help the body move more normally. In other words, we are using it as part of a care plan aimed at the source of the problem, not just the symptom. A typical session is usually quick. We start by listening carefully to what you are feeling, where the pain shows up, what makes it worse, and what you have already tried. Then we identify the tight or irritated muscles that may be contributing to the problem. The treatment itself is targeted and specific. Some people feel relief right away, while others notice the change more gradually over the next day or two as the muscle settles down. It is also normal to have some temporary soreness after dry needling. That can feel a little like the soreness you might get after a hard workout. Some people notice mild heaviness, tenderness, or a little fatigue in the treated area for a short time. That does not mean something went wrong. In many cases, it is simply the body responding to the treatment. We always guide patients on what to expect and how to support the area afterward so they can recover comfortably. A lot of people also want to know how many sessions it takes. The honest answer is that it depends on the person, the condition, and how long the problem has been building. Some people notice meaningful change after just 1 or 2 visits. Others with more persistent pain may need a series of treatments as part of a broader care plan. Dry needling works best when it is combined with the right kind of chiropractic care, movement, mobility work, and supportive home recommendations. Who is a good candidate? Many people with muscle tension, sciatica-related symptoms, neck pain, and certain headache patterns may benefit. It can be especially helpful for people who feel stuck, like they have tried stretching, resting, or over-the-counter options, but still are not getting lasting results. It may also be a good fit for people whose pain seems to flare with posture, stress, repeated movement, or muscle guarding. Who is not a good candidate? That is something we always evaluate carefully first. Dry needling may not be appropriate for everyone, including people with certain bleeding concerns, needle-related fears that are severe, some medical conditions or situations where a different approach would be safer or more effective. That is why a proper evaluation matters. We never want to guess when it comes to your health. We want to make sure the care plan is safe, appropriate, and tailored to you. If you have been living with sciatic pain or headaches and wondering whether there is actually a reason they keep coming back, there may be. Pain rarely happens in isolation. It is often connected to movement, muscle tension, stress, posture, and how your body has been compensating over time. The good news is that once we understand what is driving the problem, we can usually do a much better job addressing it. At Waves of Wellness Chiropractic, our goal is to help you feel better, move better, and get back to the things you enjoy with less pain getting in the way. If you are in Leland or the surrounding area and you are curious whether dry needling could help with your sciatica or headaches, I would encourage you to call us and schedule your first appointment. We will take the time to listen, evaluate, and talk through the options that make the most sense for you. Call Waves of Wellness Chiropractic at 910-859-8359 to book your first appointment today. We are located at 473 Old Waterford Way, Suite 118 in Leland, North Carolina. If this was helpful, please like and subscribe for more education on how we help people feel and function their best.